Okay, hi. I'm joined today with Peter. Peter is a local osteopath based in Retford. Welcome, Peter.
Thank you. Thank you
Great.
very much.
Peter, could you just share your educational background, please?
Yeah, so I started doing sports and remedial massage and did the little diplomas that you can do for that, and thoroughly enjoyed that for the last few years. I've also been doing a master's in osteopathy. Finished that last August, so now a registered osteopath with the council, the Osteopathic Council, which allows me to then do the job that I'm doing at the moment and thoroughly enjoying. So yeah, about 12 years really of looking at musculoskeletal issues and going from being sports massage, getting some extra qualifications to be able to treat people in the sense of being an osteopath.
Okay, excellent. A question, for those that don't know, what's an osteopath?
Yes, so we treat musculoskeletal issues, so muscles and skeleton, joints, looking at how the body is able to function or not function and try and get people back to their optimum health. And it's very much based on how the muscles and the skeleton is working together or not, and seeing if we can actually make a difference to try and improve the outcomes and try and get people back to being themselves as quickly as possible.
Okay. I know there's a kind of an overlap or similarity, and you've probably been asked many times before, what's the difference between an osteopath, physio, and the other one is chiro?
It is a frequently asked question, and on the surface there does appear to be slightly differently. It's hard always to tell how we differ from other practitioners, and best to have a look at people's websites and to make inquiries and just see if the person, that practitioner, is right for you, because there are on the surface there appears to be similarities, but we all do things slightly differently. Even osteopaths may have a slightly different approach to a different osteopath, etc. It's about finding out what the person needs and how you might be able to help them, and it's very much a bespoke treatment, and therefore I suppose in a way there isn't a one answer that fits that type of question, sadly. Even some of the literature would show quite a lot of similarities between osteopathy and physiotherapy, but again it's finding out about how the practitioner might best be able to suit the person, and also there's a lot of trust and relationship building that goes on as well. It's whether you actually get on with that person, you make a connection with that person. That's part of the healing process. We consider that we're taking very much a personal interest in the person, therefore they've also got to have that connection with the practitioner. So there's lots of different aspects to finding the right practitioner for the person.
Yeah. So in summary, pretty much all that a physio can do, okay, because they seem to be very popular, you can do.
We do very much a similar type of job. I think the approach might be just slightly different based on the expertise and the different specialisms that the practitioner has. We are looking very much at increasing mobility of joints, reducing pain, getting the person moving. So there is a lot of exercise prescription, taking people through different types of exercise programs, but also soft tissue work, sometimes known as massage, mobilization of joints, getting a shoulder to move and to articulate it, to make it just move a lot better than it might be doing in its current state. So yes, there are lots of overlaps, but we are very much interested in pain reduction, getting joints moving, getting people back to their function, to be able to do things that they're not able to do at the moment.
Okay, great. And what conditions do you see a lot of in your clinic?
Yeah, a huge variety really, and it is that case of being able to diagnose what's going on with somebody in terms of their muscles and their skeleton, and then make a decision if osteopathy is the right thing for them. So lots of people come through the door, we have a consultation, and then actually maybe a question that we refer on to other practitioners, back to their GP, for example, if we feel that it's something beyond the scope of osteopathy. So if it's straightforward mechanical, non-specific low back pain, let's say, there are certain things that we can do. If it is a more medical serious condition, then a referral back to the GP, for example, something infectious or to do with the autoimmune system. And then the classic situation of trapped nerves. People often say, oh, I think I've trapped a nerve or nerve impingement. And so for back pain tends to be things like sciatica. But again, there are various things that we can do. But it might also need referring back to the GP for imaging, for a scan, etc., and then to take it from there and to try and create a way forward for that person. So it's very much a question of hearing what they've got to say, doing the consultation. For us, the consultation is a really important part of the job, and we are able to spend quite a lot of time with people. And I think that's one of the benefits of osteopathy, that we're set up to really hear what's going on, to do a thorough examination. And that's why it can sometimes take up to an hour to actually have a consultation with a person, find out truly what's going on, and then take the necessary steps from there onwards.
So what can a patient expect on the first visit?
Yeah, so usually an hour is the first consultation. A lot of listening, maybe prompting with a few questions about how did it begin, where is it specifically hurting, are you not able to do something that you'd really like to be able to do, what is the duration, do you do anything that makes it currently better or you feel makes it worse, have you taken any medication, how do you think that is affecting, have you seen any other practitioners and what has the effect of that been, etc. Just to build a really big whole picture of the person. Lifestyle, how is that impacting? Because we know that lifestyle does impact on someone's ability to get better, or just to feel that they can return back to functionality. And then there'll be some testing and an examination, usually to build a more detailed picture, then some treatment, and usually then aftercare advice will involve some type of advice on movement. We might demonstrate how to move and to do some exercises actually in the treatment session. There may be a follow-up session after that, not always. It's not the best business model, osteopathy, in a sense, because we want to get people back to their optimum health as quickly as possible. And so there isn't usually a long-winded prescription of follow-up appointments. We try very much to do the consultation, do a couple of treatments, and then get you back to doing everything for yourself and allow the body to heal itself if possible. And the best exercise that anyone could do really is the exercise that they actually do. So we try and make the exercises nice and gentle, nice and doable. So people aren't going away with this scary list of things that they need to do in order to get better. It's really a case of trying to show you everyday simple little things that you can do. Sometimes we call them putting on the kettle exercises. You can lift your toes, you can stretch your calves, you can move your shoulders whilst you're waiting for the kettle to boil, and which about trying to make things as realistic as possible so the person will actually go away and be able to do their rehab, their series of exercises.
That's brilliant. Do you explain? I mean, I've had one complaint I get a lot of is that they go to their practitioner and they give them these exercises to do, and they spend very little time explaining it to them. Yeah, and I guess with you it's different.
It is important to be able to at least work out what is right for the person. Not everyone's going to be able to do an exercise program just like a standard, here's something to watch on the internet. There is a lot of material out there on YouTube, etc. And it's good for the person to be able to refer to something, but then I would always send a little follow-up saying, just do this part and do that part. And for you at the moment, stage 1, stage 2 in the next few weeks would be just to do this. And it is about making it as bespoke as possible so that they're not going to make themselves worse. And I think sometimes people, the frequently asked question is, oh, I didn't want to do that in case I made myself feel worse. And yes, it is about just trying to work out what is best for the person. But actually, in a nutshell, usually some movement is better than no movement. And if they are joining a Zumba class, they're going swimming, they're doing something with other people, often people enjoy it. And through the enjoyment of moving, that's part of the picture, really. Get into a bit of movement, enjoy it. You've got more chance of doing the exercise, doing the movement, and then you gradually, people start to feel better, and it's a great picture.
And you treat a lot of adults and children, or?
I do see lots of adults, obviously, and I do have a policy of seeing children if their parents come along with them and have a good joint discussion between the parent and the child. Not babies. I've chosen not to do that age group, but yes, and at the moment, children in sporting teams seems to be the usual child that comes in with their parents. They're in a football team, they're in a hockey team, they're in a baseball team, or whatever, and yeah, just checking out they've not injured themselves and the best way forward to rehab and whatever.
Yes, excellent. And okay, home visits. Do you do that?
I do home visits for people that are housebound. I want osteopathy to be available to everybody where possible. And although there is a time element involved in traveling to someone, I wouldn't want somebody to miss out just because they aren't able to leave the house. So I've made a conscious decision that I will try where possible for someone who is housebound to go and visit them and to do a visit in their own home. Absolutely.
That's brilliant, especially for those disabled, wheelchair-bound patients. It's a struggle for them to get in a car, let alone go steps or to have a journey. That's brilliant. Great. And any takeaway tips? Okay.
Well, there are lots of things that people can do for themselves, and I think it does come back to that idea of like, are they doing the right thing? So if people are able to make a consultation, to attend a consultation, or at least contact a practitioner and just sound out whether osteopathy is right for them, there's no harm in making that phone call. And I'm very receptive to having chats with people over the telephone and saying, oh, it doesn't sound like osteopathy is the thing for you. Have you thought about this? Or actually, yes, I think you would benefit from osteopathy. So making that phone call, looking at the practitioner's websites is often the best way forward. Then having a conversation and just seeing if you can work together to help somebody to regain functionality, really. So it is a question of just having a look out what is in Retford. And there's so many wonderful practitioners here in Retford. We are really spoiled for choice, which is an amazing position to be in.
Lovely. And how does someone contact you?
Yes, I've got a website, www.retfordosteoclinic.com. I'll obviously have a phone number as well, and very responsive to text messages or WhatsApp messages or whatever. So whatever is convenient for the person, make that first step, get in touch. I can always call you back, have a chat and see if osteopathy is the right thing for them.
Brilliant. Excellent, Peter. Thank you very much. And just to repeat your website again, it's retfordosteoclinic.com. Great, excellent. So if you're listening out there, you need a great osteopath, check Peter out. Thank you, Peter. Wonderful to speak to you again.
Thank you. Bye-bye. Thank you.